Hi, everyone. So, welcome back. Um, I do not know how long I'll be able to stay on the live for, just because I am on call, which means that people are calling me. Did I cut off? Hi, everyone. So, I am on call this weekend, which means that people are paging me to ask questions all week. And then I also have laboring patients on the OB floor. And so I do not know how long I'll be able to stay on this live, depending on who calls and if London wakes up or not. So today, I told you guys on Instagram that I wanted to talk about family medicine and all the aspects around family medicine, how much we get paid, all the different things that we can do. Because I feel like there are so many things that we do that people don't really know about. And so I always feel like there is such a need for more family medicine physicians. Everywhere, and especially now, like you can see with this pandemic, we are one of the big workforces that are helping people and screening people and still working and providing preventative care. And so I just wanted to tell you more about the profession that I love. And so, family medicine residency is 3 years. And what I love about it is that it is so broad. There's so many things that you can do. It's hard at the same time, it's exciting because you get to do so many different things. As I said, like I'm taking care of OB patients, I'm going to deliver them. I do steroid injections on a regular basis into knees and shoulders. I do nerve blocks like greater occipital nerve blocks for headaches. I do toenail removals and suturing skin together. There's lots of fellowships that you can do too, like an EM fellowship or a sports medicine fellowship or palliative care fellowship. There's so many different things that you can do that that you're not limited at all. I know people go into like I don't think it's called like cosmetics, but like on the beauty side of things where they just do Botox and fillers. Um, my friend was actually, or one of my co-residents was texting me today saying that we should take a Botox class. And so several of us are going to get together and try to take a course together. Oh my gosh, I'm so happy you're part of the stream too. I love talking to you guys on this little thing. So feel free to ask me questions about anything we're talking about or anything in general. You guys know that, like, I think growing up, like, I always knew that I wanted to be a doctor and I just didn't know what kind. And so when people ask me, like, why did you go into medicine? I feel like my answer is rather a little selfish because I wanted that connection. Like I wanted to have a family and I wanted, um, that bond that I guess I didn't really find at home. And so when I shadowed other physicians and I saw the type of relationship that they had with their patients, like it really touched me. And I felt like, you know, medicine itself filled a part of me that was missing. And so I love, 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 love like I couldn't imagine myself doing something else because I can see moms and kids. Like when I work at the respiratory clinic, I also work with internal medicine residents and they can't see any of the kids. And I literally can see anybody. That's the same with urgent care, So if you want to work at urgent care, you have to know how to like see everybody, including kids. And um, you guys ask if I do OMM in my residency. Our residency has osteopathic recognition, and it's one of the top residencies for OMM in the region. And so a lot of people come to me for osteopathic manipulative treatment. And they actually, so since this whole pandemic thing, we're not supposed to see people in person. And so I have a lot of people who chronic pain who I see like once a month, and I treat them with OMT, and it helps them from like taking pain medications. And so now they're all like, Jenny, what am I going to do? Or they text my other preceptors. They're like, what am I going to do? My headaches are back, and like all these things. And it's like our hands are tied because we're really not supposed to see people to prevent the spread. But yeah. Um, and then let's see. But yeah, I practice OMT like all the time, almost every day. If I'm not treating patients, then I'm treating friends and coworkers or family. Um, it is hard right now. I'm super tired today just because like I worked all day in the acute respiratory clinic. Like I saw 15 patients in a half day. I barely got time to pump. I didn't eat until like 3 p.m. And then I had a clinic patient scheduled, and then I have to see people on the OB floor. And then I'm also on call, and then people are calling in a lot because they can't be seen by their doctor and they're really worried about having COVID-19. And so it's been a really hard and busy day. That being said, that is not true for when you go out into practice. So, the job is what you make of it, and you determine your own schedule once you start like actual being a doctor. Like you don't have much say when you're in residency because they assign you shifts and they tell you like you have to work here, and they really don't really give you a choice. And so you can work up to like 80 hours a week. A lot of residents sometimes work more than that, but you're not supposed to according to the ACGME guidelines. Like they're, 80 hours, it's supposed to be your max hours. So yeah, you can go over for things like OB, but so there are exceptions, but we're all tired. This is not normal. Um, Residency is it's grueling, no matter which residency you go to. And so, um, let's see. I think a lot of people are worried about the pay as a family medicine physician. Like, do you get paid enough when you go into family medicine? And um, it's because it takes so much money to go into medical school. Like, I'm very transparent right now. I have like $350,000 around there in school loans. And as of right now, um, I think they said that all federal loans are have zero interest. So right now my loans are not like accruing. So usually every year it's $10,000 in interest, and right now it's not. So I don't know how long that's going to last, but I don't even have money to pay it down right now. So we're just going to let it ride. Um, and they also said we don't have to pay for the next 2 months or whatever. But yes, I see why people can feel like, oh, they need to go into a profession where they get paid a lot of money, but you can get paid as a family medicine physician. Um, in Washington, if you work full time, the average pay offered is $240,000 for full time equivalent, which means that you have to be able to see your schedule has to be open to three 36 patient hours. So that's the hours that you're available to see patients. That doesn't count writing notes, answering phone calls, reviewing labs, answering patient emails, all that stuff. So it doesn't count all of that. So even if you're working like a 1.0, sometimes it can add up with all the other things that you're doing and end up being 60 to 80 hours a week. And that's why I chose specifically just to do a point 0.5, which is halftime, which is like hours a week. Um, so everyone tells me like, "Oh, you can get a scribe and, it'll make your life a lot easier and blah, blah." Like, I don't know how it's going to be yet, but a scribe is expensive, especially for someone who is not making much money already. Um, so we'll see how it goes. Like, eventually, I might think that it's beneficial to have a scribe, but right now I'm like pretty fast at writing my notes as long as I have a dictation mic called the Dragon. Um, and so, yeah. And then if you do things on the side, like OMT can also be a cash practice, like a fee for service. And I know, like, eventually, I feel like when you're good at OMT, a lot of people just come to you for OMT. So eventually, if that's all I'm doing, I might start my own practice. What else? I don't know how much, like, this is a really hard time for everyone, right? Because right now I can't even be board certified. So someone asked, like, if it's possible for undergraduate students to help with COVID-19 efforts in the medical profession, even from home. It's really hard right now to um, like, everything's up in the air. Like, I know people want to help, but what we really need is like protective equipment, PPE. I guess you can like write letters um, to the government and saying that this is what we need, but otherwise, it's just like we don't have the resources right now. We can't even have room for medical students. If you can design an app for telemedicine, there's lots of glitches right now. I don't know. Like, I haven't thought much outside of the box just because I've been so busy. Um, but yeah, also other things that you can do in family medicine that earns a lot of money is like urgent care. Um, Gets paid, like, my urgent care doc, she is family medicine trained and she gets paid over 300,000 plus whatever bonuses. When I was working with her, she was talking about how she wanted to buy her husband a airplane. Yes, that's right. Like, she's like, not even a car. It's like, "Oh, I'm gonna buy my husband a plane because he used to be a pilot." I was like, "Well, that's cool," So, like, you can do a lot of things in family medicine. There's, um, I know there's an NP who or nurse practitioner who does like Botox and fillers, and that's like really lucrative as well. Um, I'm not really worried about job security. I feel like everybody always needs a family medicine physician. Even if you are a PA, physician's assistant, you need to be under somebody who, has like a doctor's degree. So I think the training is a lot different. Our training is a lot more extensive. And so eventually, I think a PA can run a practice, but not straight out of school. Um, let's see. I don't know if I talked about like, there's a lot of questions on here that I don't scroll through. Um, yeah, I feel like when I was a med student, I went through all the phases where I wanted to be a surgeon, and then I realized I didn't like the schedule, and I didn't like to just operate in the abdomen. And then I thought about OB because then I got to deliver moms, and you know, I feel like if I were to do prenatal care, I would want to be at all the deliveries, and I just can't handle the schedule. Like, even right now, when I have a laboring OB patient, I'm just like, God, I am so tired. Um, and then at one point, I wanted to do emergency medicine, but I realized that I liked continuity. Like, I like to know like what happens to my patients after they've gone off from the ED, like if they went home or if they were admitted, like what happened to them. You kind in the ED, they kind of just like go off into the abyss after you work them up, and so family medicine, I feel like is perfect for me. Um, some family medicines do get paid like salary, which means that it doesn't matter how many patients they see and how many, um, it's paid basically their set amount of patient hours. So that means they have to see at least 36 patient hours. That doesn't count notes or anything like that. Yes, some doctors do have like double board certification, but I I think that that was like back in the day. I don't know if anyone does that anymore. Um, how does the pay system work in the hospital setting? Is there any different than outpatient? Yes, I believe it's different because I think you get paid more when you are working in the hospital setting because they charge like for the different things. It's different from like a hospital charge versus the outpatient charge versus like if you work in an independent practice. All I feel like all those charges are different. It's like way over my head. I don't know. It depends on like how many days a patient stays in hospital, depends on their diagnosis, depends on the average length of stay depending on their diagnosis. So there's lots of like different factors that contribute into that. So I don't really know myself. I'm paid on a salary. I get paid like nothing as a family medicine resident and work crazy hours. And so I have no idea how that's going to work. Um, the most common complaints about the job of family medicine by new grads. I don't like, I feel like paperwork, administration is a big key and feeling underappreciated. The one thing about this whole pandemic is that for the first time, people are valuing, not for the first time, but like I feel like in a long time, people are valuing family medicine more than previously. Like they're like, oh, family medicine is really useful now. Um, and so I do feel like more appreciated. People are telling me thank you for what I do. And I was like, I do this every day. And I wasn't getting appreciated before. Um, but one of the common complaints, look at Stan. One of the common complaints is that there's too much paperwork. It takes a long time to get paid for the work that you do because of documentation. Like patients are always so mad that they have to wait for the doctor, but they get mad if the doctor doesn't spend as much time with them. And then after that, we have to write a really thorough note explaining everything that we talked about. And so when you go to an office visit, there's so many things that add up in it. So we really want patients to come like 15 minutes in advance because your whole 30-minute visit also counts like check-in time, the nurse or the MA or the CNA or whatever checking your vital signs and asking about like certain things and screening questions that goes into your whole 30-minute visit. So if you're scheduled at say 1:30 and you show up right at 1:30 and they have to check you in and it takes 15 minutes and by the time that I come see you it's already 1:45 and my next patient is at 2 o'clock, and then you want to talk about 10 problems because you haven't seen me in a long time, like that's just not going to fly right with because I have to see my next patient at 2 o'clock. And so I always tell patients, please come earlier because then we get to spend more time together. And then after that, after you leave, I have to write down, like, oh, this is what we talked about, like, remember to take these medications, or like, this is your next visit. So I print that out for you. You go home. And then in my note, I talk about every single thing that we talked about. So if you had a bloody nose, I talk about when the bloody nose started, how long it lasted, what made it better, what made it worse, what were you doing at that time? Do you have a family history of a bleeding disorder? Like, what have you tried before? Do we need further management? And then I have to talk about like why I'm not doing anything about it, the suggestions that I've made, or do you need a referral to ENT to zap this thing so it would stop bleeding? Like, I have to talk about all that stuff um, in my note. And so, yeah, I see a patient in 15 minutes, but I also like talk about all these other things in my note for the next person to see you, like if you have the same problem later on, another doctor who you're seeing would always look back and be like, oh, yeah, this problem has been addressed before. What else can we do? So instead of like starting all over again. And so doctors are the only ones without a union. And so, like a nurse or like I don't know if you guys realize this, but nurses, CNAs, and administration, everybody gets paid if a patient no shows besides the doctor. So if a surgery is canceled or if they no show, like the doctor still has to be there, but they don't get paid. But everybody else gets paid. And so I don't know at what point we didn't value the like the physician's time, but that's what it's become. And so right now, I think we're trying to regain that. I wouldn't say independence, but like we need to like regain our ability to like make these decisions. Like residents have been trying to form a union, but I don't know if that's in the works or not. I'm almost done anyways. Luckily, I signed with a place that really values their doctors and is like they always talk about work life balance. And everybody there works part time. So I'm really excited to start working there. Um, do I feel like I'll have good work life balance? Yeah. So, like right now, I told you guys that full-time work equivalent is $240,000 for basically if you work full-time. So basically, I'll get half of that if I work half-time, and I will only work like 1-2 days a week. Yep. So yes, I signed with somebody already, and that I will be starting end of this year, hopefully. I don't know how it's going to go because I can't get board certified right now due to the whole pandemic thing. So hopefully I still have a job. If not, I can still work at the acute respiratory clinics and do like per diem and stuff like that. And I can still do OMT on the side. So being a doctor, that's one of the good things about like job security. So yeah, thanks guys. You guys are so sweet. Um, let's see. Yeah, so I'm in Washington State. Yay! I know. I'm so happy. Like residency, med school, this whole process has been such a long journey. And you guys ask me all the time if it's worth it. I think you really have to, look deep down in yourself. If it's worth it for you. Like I'm really happy with my job. I'm not going to lie about that. I'm very grateful that I have job security, and I never think that I'm going to like be without a job. And so that is um, gives me less anxiety, I would say. But if I were to do it all again, would I? I don't know if I were to do it again if I had kids. I don't know. That's really hard. Like, I really love OMT and I can't imagine myself doing anything else. But I don't know if I'd be able to do OMT without going to the whole med school process, because it's a lot of my life. Like, I sacrificed my whole 20s. Like, when people were partying, when people were traveling and discovering themselves, I was at school, in the anatomy lab, in the library, getting fat. Doing the whole like med school 30. I don't know. Like, I feel like I had to grow up really fast. At the same time, I feel like being a doctor, um, like molded me into like a better person. I have better empathy. I feel like I'm a better person because of the interactions I have with my patients. Like, they make me a better person, including like my family and all that stuff. Um, but the road is so long. It's so long. Um, I don't know if that can change. Um, I feel like being a PA is great. I just like more autonomy. Like, I like making my own decisions. I like having the final say in what medication I choose. And I don't know, like if I wanted to start my own practice, but being a PA is great. It's like 2 years, I think, 1 year of didactics and 1 year of clinicals, and then you can start working right away. And a lot of it's on the job training. You can jump around with different specialties. You can do surgery. You can do derm. Um, you can do family medicine. Like, I feel like the opportunities are endless. So maybe if I already had a family and I still wanted to do medicine, I could possibly go into PA school. Um, I don't know. I don't know. Um, I'm glad that I'm very grateful that I got into med school at the time that I did, and I'm glad I found osteopathic medicine. But yeah, I really don't know because I love being a mom, and then now I'm going to work part time, like literally 2 days a week to be a doctor. So I don't know. I really think that people should look deep down and not do it for the money, because if you're doing it for the money, like, you get paid nothing. Unless you're like an orthopedic surgeon or something like that. But in family medicine, like, you honestly don't get paid that much for the amount of stuff that you're doing, for the amount of work that you put in, and the amount of school loans that you end up going out with. Like, I came from a single family or single provider home. So my mom was the only one who worked. We had low income. I took out loans to pay for all of med school. My loans paid for basically cost of living. It paid for my apartment. It paid for food. It paid for books. It paid for the gym. Um, I took out loans for everything. So I didn't work at all. I focused everything on school because I personally feel like school should be your job. And so if you study full time, then there's really no room to work while you're in med school. So I took out loans for everything. A lot of people in my class all had the same amount of school loans. So around 300,000 when we were done. I did have some scholarships, but not much. And so if you are smarter and more talented than I, which is probably a lot of people, you could probably get more grants and scholarships. I just didn't get that many. I was also very lazy and I did not write that many essays to apply for these scholarships. My uncles would text me and email me all the time, be like, "Hey, you should apply for the scholarship, and you should um, stop living in your apartment and just live out of your car so you can stop taking out so many loans." And I was like, yeah, yeah, yeah. Med school is hard enough. I'm not going to be homeless and live out of my car. Thank you very much. um, uh, a lot of you are talking about GPA. I don't know if it's any different now as compared to when I apply to residency, I feel, or not residency, med school, I feel like every year it just gets harder and harder and harder to get into med school because a lot of people are applying. So there always has to be um, like a cutoff, right? So I think the cutoff for a science GPA back then was like a 3.0. Um, and if you didn't have them, then there are obviously different things like a post-bac program or master's program for you to boost your resume. But, in general, I feel like your GPA is just like one small part of your application. And so if you have if you have a bad GPA, then make it up in your MCAT or make it up with um, like volunteer work or, like no one has like a perfect um, application. And so I feel like you just have to be able to explain that of why you're missing some pieces in your application. If medicine is really what you want to do, then there's other routes to doing that stuff. Um, some people go to med school really late in age. Like I have a co-resident who is almost 50 and she has had multiple other careers and went into medicine a little bit later and because of her life experiences, it makes her a better physician. And so that's what people don't understand as well is that, when you go straight into med school right after college, it's hard because you haven't really experienced much of life. And so it's harder for you to connect with your patients who've experienced so much life. I feel like I was able to experience or connect with my patients more when I had a family or when I became pregnant. It was just like on a different level with some of my pregnant patients. And so I really appreciate that. I feel like I've gone through a lot over the years and like the more years I grow, basically, the more I'm able to connect with people. Mm, oh my gosh, you guys are all so supportive. I'm so lucky. Really, I'm serious. You guys are the best. Like, I love talking to you guys on here. I know it can get busy, and this whole COVID thing can be very daunting. But know that we're all in this together, right? Let's see. Yes. Are you guys all like in medicine? Like, where are you guys from? Like, how did you guys find me? I'm very interested to know because I know a lot of people on here are like moms too, and they like my content because I talk about mom stuff, which I feel like is a big part of me too. I feel so blessed that I'm able to know what's going on with my children. Like, I feel like if I didn't know any medicine, I would freak out all the time. I'm just like, is this normal? Why it just broke out into a huge rash and all the stuff. But yeah. Oh man. So pre-med people. Awesome. What other questions do you guys have? Let's see. I'm kind of like all over the place in this video. I'm also very tired. Oh my gosh, you guys. Pre-med at Berkeley, pre-med in Florida, um, Montana, M1. Some people already in med school. ICU nurse. Oh my gosh, thank you for all that you do. Oh man, this is crazy. Oh my gosh, massage therapist. That's awesome. Oh my gosh, you guys are from everywhere. That is so cool. Oh my gosh. Okay, so back to answering questions. I think, as I said before, PA profession, I do feel like there's a lot of flexibility, and you can decide what um, specialty that you want to go into, and there's lots of like training on the job, and you can go anywhere, basically into surgery or outpatient or inpatient. There's lots of different things you can do. Um, okay, so this is a hard one. Um, is it possible to go to med school with kids? And my answer is yes. It is totally possible to go to med school with kids. Is it harder? Yes, 100% it is harder. And it also depends on how old your kids are, right? I have greater women than me who went to med school and became pregnant or delivered their babies first year, third year, like every different years. And they're surgeons, general surgeons, cardiologists, anesthesiologists. They're all like amazing women. So you can do it. You can totally be a mom, go to med school, do it all. Right. But I think you just need support, and you have to be okay with not being there all the time. And so for me, like, I am just over missing stuff with my kids. Like, I feel like I had my Wyatt. I was pregnant my fourth year of medical school, gave birth, started residency when he was 8 weeks old, and then had London my second year in residency, and then delivered, and then went back to work 7 weeks later. And so I feel like they grow up way too fast. And right now, at the state that I'm working, I am missing so much of them. Um, and then when you're in med school, you study a lot. Like, I studied nonstop. I woke up and I went to classes, and then I went home and I studied till 12. I took a break to go to the gym and to eat, and then that was it. I mean, if my kids were a little older, like say they were in grade school, and if or they were teenagers and they didn't want to hang out with me, and I'll be like, "Okay, I'll go to med school." But I don't know, if my kids are really young, like I don't want to be away from them, just because for me, I feel like they're only going to be small for so long, and they're only going to love, like, be like super lovey to me for so long. Wyatt does this thing now. He's like, "I love you, mom," or "You're my best friend," or things like that. And I feel like eventually he's not going to want to cuddle with me anymore. Like, he's going to want to hang out with his friends and like play basketball or play golf, or I don't know, like he's going to want to do his own thing. And I I just want to appreciate that now, while he still wants to hang out with me, while I'm still like his coolest person ever. The best friend. I don't think so. Um, all right. Um, okay, let's answer one more question, and then I am going to head out and just take a break, because I don't know when they're going to call me next. And it's almost 10 o'clock. Okay, let's see. Um, oh my gosh, I can't pick a question because my brain is just so tired. I think I'm just going to call it. Um, I think I'm just gonna call it, guys. So let me know, message me on here, give me a list of things that we should talk about. I should go back to making real videos with you guys. I love hanging out with you guys here, but I also like making videos. Um, I will go back to that once school becomes, or not school. Gosh, I'm way too tired. I'll go back to that once work becomes less hectic. It has been really hectic lately. As I said, I worked nonstop from 7:30 in the morning, and I didn't really have a break, and I didn't eat lunch, and then I ate lunch around 3 p.m. and so and then I was still working through that. I was like stuffed some food in my face. But anyways, like it's been super busy. It's because of this whole pandemic. Um, everybody is depending on us, and I feel like I can't let people down. And so, yeah, let me know what I should talk about tomorrow. And yeah, love you guys. Thank you for all the support. I'm so happy to see everyone on here and where you guys are from and stuff. So I'll see you guys next time.